Hello friends, today I will be talking to you about neuroanatomy and the related syndrome of brain stem. So first of all, I'll talk about medulla oblongata. So first we read the neuroanatomy. So as far as neuroanatomy is concerned, in the medulla oblongata, this is the inferior cerebellar peduncle. By this, the cerebellum is attached to medulla oblongata, and here is the 10th nerve nucleus, 8th nerve nucleus. This is 5th nerve nucleus. This is sympathetic chain. And here lies the spinal lemniscus. Okay, so before I proceed further, let me explain to you what does spinal lemniscus contain. It contains pain, touch, temperature from the contralateral body. If you remember in the neuroanatomy, this is spinal cord. Pain, touch, temperature, fiber, they enter spinal cord, they cross to other side, they travel in the spinothalamic tract, and ultimately it goes to thalamus. Okay, now the spinothalamic tract which have gone to other side, they are in the brain, they are known as spinal lemniscus. So if this is the right side and if it is the left side, the right side is spinal lemniscus, it contains left sided pain, touch and temperature. Okay, with this N, here is the cortico-spinal tract. Here is the 12th nerve, and here is the medial lemniscus. Now what does it contain? This contains contralateral position vibration sense. This is the anatomy of the medulla oblongata. Now this part of the brain is supplied by either vertebral artery or sometime pica. Pica is posterior inferior cerebellar artery. Pica is also a branch of vertebral artery. So this part, a direct branch may come from vertebral artery or pica. This supply. Suppose this is infarcted or some bleeding occurs in this artery. So now what will happen to the patient? What clinical feature will have to patient? Look at this. Look at the board now. Patient will have ipsilateral cerebellar feature, ipsilateral 10th nerve palsy, 8th nerve palsy, 5th nerve palsy, Horner syndrome because of involvement of sympathetic chain. But there will be contralateral loss of pain, touch and temperature. This is known as lateral medullary syndrome. Also known as Wallenberg syndrome. So in the feature are ipsilateral cerebellar features, cerebral signs, ipsilateral 10th nerve, 8th nerve, 5th nerve palsy, and ipsilateral Horner syndrome. But there will be contralateral loss of pain, touch, and temperature. This is the summary of the lateral medullary syndrome, which you can make a box also. Okay. Now we move further. This part of brain is supplied by vertebral artery. Now, if this part of the brain is involved, then the patient has feature of medial medullary syndrome. So what happened in the medial medullary syndrome? Medial medullary syndrome. So what will happen? There will be ipsilateral 12th nerve palsy because of 12th nerve involvement. And this corticospinal tract, which will go down and cross to other side. So there will be contralateral contralateral hemiplegia. And contralateral hemianesthesia. Why hemianesthesia? Because of medial lemniscus involvement, which I told you contain contralateral position vibration sense. So this is what we will get in medial medullary syndrome. So friends, we got lateral and medial medullary syndrome in medulla oblongata. Now we talk about pons. So first we read the neuroanatomy. As far as pons is concerned, here is the corticospinal tract. Here is the 6th nerve, and here is the 7th nerve. 6th nerve and 7th nerve. This part of the brain is supplied by ICA. ICA is anterior inferior cerebellar artery. So what will happen? It will lead to Miller-Gubler syndrome. So in this syndrome, there will be ipsilateral 6th and 7th nerve palsy. But there will be contralateral hemiplegia. Okay, so this what we'll get in Miller-Gubler syndrome. Now we move on to midbrain. let's talk about anatomy. Okay, this is the superior cerebellar peduncle, by which the midbrain is attached to cerebellum. Here is the corticospinal tract. This is the third nerve. Here is the red nucleus. Red nucleus. Okay. Now, this is the right side. This left side. This is the cerebellum. Cerebellum. Of left side, cerebellum. Okay. Now this red nucleus, it gets afferent and efferent from cerebellum of other side. This is the right side red nucleus, cerebellum of left side. This is the basic anatomy of midbrain. Now let's see. This part of the brain is supplied by branch of posterior cerebral artery. Okay. Now how patient will manifest? We talk about this is ipsilateral, this is contralateral. So there will be ipsilateral third nerve palsy and due to third nerve and contralateral hemiplegia because of corticospinal tract, and this is known as Weber syndrome. Weber, ipsilateral third nerve palsy, contralateral hemiplegia. Okay. Now, at times, involvement may be like this. Again, another branch of posterior cerebral artery. Now, what will happen? Ipsilateral third nerve palsy, but there will be contralateral cerebellar feature. Contralateral cerebellar features, and this is known as Benedict syndrome. So ipsilateral third nerve palsy and contralateral cerebellar feature because of this red nucleus is getting afferent and efferent from cerebellum of contralateral cerebellar feature. So there will not be any clinical difference. Clinically they will be same. Ipsilateral third nerve contracerebellar, and this is known as north nasal syndrome. At time, these three are whole are involved. Artery involved in all same is PCA. That means this patient will, where red nucleus is also involved, clinically same, ipsi third contracerebellar, and this is known as clot syndrome. So clot syndrome is nothing but a combination of Benedict and north nasal is clot syndrome. So friends, we can make a good summary of the all. This is a Weber. This is a Weber. So sorry. It's a Weber syndrome. So friend, the summary of the midbrain region is in all the four syndrome, there is ipsilateral third nerve palsy. But in Weber, there is contralateral hemiplegia, and other three is contralateral cerebellar feature. So we can revise the entire brain stem syndrome only in just 30 to 40 seconds. So friends, let's have a quick revision. In lateral medullary syndrome, there is ipsilateral cerebellar, 10th, 8th, fifth Horner, contralateral hemiplegia. Oh, sorry, contralateral cerebellum. The contralateral loss of pain, touch and temperature. Sorry. Now in medial medullary syndrome, there is ipsilateral 12th nerve palsy, contralateral hemiplegia, contralateral loss of position vibration. In Miller-Gubler syndrome, ipsilateral 6th 7th palsy and contralateral hemiplegia. In midbrain syndrome, in all the four syndrome, ipsilateral 3rd nerve palsy, in Weber, contralateral hemiplegia, in all other three, contralateral loss of contralateral this cerebellar feature will be there. Now, next talk I'll be taking on Thursday. Now friends, I got so many people are talking to me, they want to ask questions to me. So till now I am doing this lecture via Facebook, and the next Thursday also I will be doing on Facebook. But now we are going a step ahead where you can ask question to me directly. So from next Monday onward, we plan to do it via webinar. In webinar, you will be live. You can ask question to me. For that, we have to invite you. So what you do, you send your details, your name. You send your name, your college, which year you are doing, which years you are studying, or intern, post intern, and your email ID, and you send me to this. Contact Dr. Bhatia at gmail.com. So from 17th April onward, you can even ask question to me. Okay, and once we have your information, we will like to give you more questions to do some photograph. All these will be giving to you, but for that you have to contact us. So please send the details so that we are more close to each other. Thank you very much for watching this video. But next lecture will be again via Facebook, but on 17th April onward it will be via webinar. Stay tuned. Thank you very much.